Hello, everyone, and welcome to the latest installment of Let's Keep Moving with the APDA. Over the next few months, my colleagues and I have been and will be presenting a series called Your PD Exercise Toolkit. Today, I will be presenting part 2, the optimal dose of exercise. How much is enough? And my name is Teresa Baker, and I'm one of the physical therapists as part of this team at Boston University Center for Neurorehabilitation and the APDA National Rehab Resource and Referral Center. This is our team here. This is our contact information if you'd like to be in touch with us, and we would love it if you were following us on social media. So we will start today with the key components of an exercise program. In last month, Tim covered exercise fundamentals for people with Parkinson's disease, and he presented the important components of an exercise program and the research evidence supporting our understanding of the types of exercise which make up a comprehensive exercise plan. For anyone who has not had the chance to see Tim's talk, I would really encourage you to see it. All of our past presentations can be viewed from the APDA website. And with several of our past presentations in the Let's Keep Moving series, we have mentioned this booklet that you see on the screen now. It's called Be Active and Beyond. We want to make sure everyone is aware that this is a free resource from the APDA, and it can be downloaded from the website. This is a publication that our team developed and has more information regarding exercise for people with Parkinson's. Several of the pictures that I'll show today will come from the Be Active booklet. Another thing I want to mention at the start of the presentation today is that the information is intended for general information. So I don't want anyone to consider this as individual medical advice. We would love to take your questions today and have you share your comments with us, but please do consult your doctor and physical therapist to determine what might be the safest way for you to work towards any of these exercise recommendations. So during last month's presentation, Tim so nicely covered the various components of a comprehensive exercise program for someone with Parkinson's disease. And here we see the 4 categories of an exercise program: aerobic training, strength training, balance training, flexibility. So let's get into the recommended dosage and the optimal dosage for each one of these. Let's start with aerobic exercise. In general, I'm curious for anyone in the audience today, what type of aerobic exercise do you enjoy doing? Maybe you could share that with us in the chat. The reason I ask is, as Tim mentioned last month, several recent research studies with people with Parkinson's disease involved different types of aerobic exercise: brisk walking outside, treadmill walking, stationary cycling. In those studies, the participants in the groups who exercised at least at moderate intensity showed reduction in the motor or movement symptom severity. So a slowing of the worsening of the motor symptoms in Parkinson's. And one of those studies showed an improvement in the motor symptoms after a 6-month period. That was a study of brisk walking outside. So while we don't have research evidence about every type of aerobic exercise, what seems to emerge is that the type of exercise is not necessarily the critical component, which is so encouraging because it means you have a choice of what type of aerobic exercise you can do: walking, cycling, something else you enjoy. What seems to be a more critical component is the intensity of the exercise. So let's talk about that. And in aerobic exercise, what seems to emerge from the evidence is that the intensity matters. And by intensity, I mean what it feels like while you're performing the exercise. So how hard you're working, what your exertion is like, And it seems that the evidence suggests that working at least at the moderate intensity level is what matters. And so, how do you know that you're at moderate intensity? At moderate intensity, you might feel like your heart is beating faster. You might feel like you're breathing deeper, might feel like you're sweating. One way we also recommend is using a self assessment scale of exertion. So, this is an example of one type of scale. This scale is a number scale. It starts at 1 and goes up to 10, with 1 being the lower end of exertion and 10 being the higher end of exertion. So, on this scale, moderate intensity would be considered like a 4 or 5, 6. Another way to measure exertion is the talk test, which means that while you're doing aerobic exercise, you might be breathing deeper, but you would still be able to talk, carry on a conversation, but you would not have enough breath to sing. So the idea seems to emerge that if someone is exercising at least at moderate intensity, that seems to be the critical factor rather than the type of exercise. Um, and another component of aerobic exercise um, that matters for dosing is the amount of time someone's doing the exercise. So what is recommended there? The recommendation is 150 minutes per week of moderate intensity aerobic exercise. And so for this, we know we want to break that down into increments. And the goal really is so that is considered a goal, 150 minutes in the week. So we could break that up in whatever way makes sense for someone. So it could be, say, a 30-minute walk on 5 different days. Could be one day we have a 10-minute walk, and another day there's a longer session. What's important to keep in mind is that this is something to work up towards in a way that is safe and enjoyable for you. So again, I am curious for everyone in the audience, how do you get in your aerobic activity? And how much do you typically tend to get in during a week? For aerobic activity, kind of a general summary, the type of activity may be variable. The intensity, at least at a moderate level, and working up towards the dosage of this goal of 150 minutes over the course of a week. But let's turn our attention now to recommendations for strength training. A key principle in strength training is the use of resistance challenge to challenge the muscles and overload the muscles and in time increase the strength. So there are many ways to increase resistance. One example is using body weight, and that's what the Be Active and Beyond booklet includes examples of body weight style exercise that doesn't require any additional equipment. Another way to increase resistance is to use weights as something that someone's lifting or pulling, and also to use maybe resistance bands. Another way to increase overall resistance. So there's many options here. But strengthening is important for all the major muscle groups. We will often particularly target the large muscle groups in the legs, particularly those that extend the hips like the glutes or extend the knee like the quadriceps. Also target calf muscles. Strengthening in these muscle groups have important effects for walking. We also emphasize strengthening muscles of the back and the core, which are important for everyday functional functional activities. When it comes to strengthening, we want to repeat the movement in a controlled manner. So recommendations to perform 8 to 12 repetitions in a set, and should feel like by the time you get to the last 1 or 2 repetitions that the muscles are being challenged. You might feel tired, you can feel like you're working. And then repeat this, the exercise for 2 or 3 sets. And then that recommendation is repeated for each strengthening exercise. So the idea really is that the strengthening exercise program should feel challenging, which is another key component, the idea of progressive resistance challenge. And I just want to give an example of that. Progressive resistance strengthening means that the resistance may change over time as someone is getting stronger. Just want to use this example of a squat exercise. The example of the first picture, the person in the orange shirt, that person is fully sitting down and fully standing as they're performing their exercise. When someone starts an exercise program, this may feel like quite a challenge. Over time, as someone gets stronger, might consider something like a partial squat. As you can see, the person in the pink shirt is not fully sitting down, but partially going into a squat. So the legs don't get as much of a rest as someone would in the full sitting position. So she's in a partial squat and then she returns to standing and repeats the exercise that way. And you can see another variation of the progression of the exercise is the person in the blue shirt doing a full squat. So that person, the leg muscles are holding the resistance a little bit longer in a slightly lower position, which creates more time under tension for the muscles, creates more challenge. So the idea with the strengthening program is that the resistance should feel challenging and that the program should progress along as someone's getting stronger. This is a key element of the strengthening program and one that a physical therapist or another exercise professional could assist with in developing. So next recommendation, another category of exercise is balance training. And this category, for this category, our team did a series of webinars last year in the Let's Keep Moving series with more detail on how balance affects people with Parkinson's disease, balance assessment, and balance training. For balance training, the idea with the training program is that we find kind of the just right challenge, which means that the movement or the activity is challenging, but it's still safe for someone to perform. And that will be a little different for everyone. And the idea of that balance training is challenging balance, challenging coordination, challenging agility or quick movement. It may also include activities that challenge functional agility. So turning, moving, reaching, going over obstacles. These are activities that we go through in regular daily life. Balance program may also include changing directions, may also include weight shifting, kind of bigger movements that have more amplitude. Another component of balance training may include activities that challenge by doing two things at the same time, or multitasking, or something that involves cognitive distraction, something that might involve, say, memory, like remembering a sequence, such as, say, a dance movement or a dance series. And because this is distracting the attention away from what's going on, this can create quite a bit of balance challenge. And it is good to practice things like that would happen in regular life as part of your balance program. So some ways to do this involve classes such as, say, a Tai Chi class, dance class, maybe a yoga-based class. So classes that incorporate these type of balance activities as part of their regular kind of training. So it's another option to consider doing this in kind of a group series. And the balance training is definitely something that a physical therapist could guide and develop the appropriate level of challenge for someone interested in training this way. Next kind of component of training involves flexibility training. And this picture is from one of the first published cases of someone with Parkinson's, a demonstration of what could be a typical posture, someone who's in a slightly forward bending position, maybe slightly having knees bent, with maybe a tendency to be a little more tight in the front of the body. We do know that people with Parkinson's tend to have a little more stiffness and a little more restricted joint range of motion. So the goals of a flexibility training or stretching program are to increase flexibility, increase range of motion, and reduce the stiffness that people are feeling. For flexibility training, it's often more effective after the body has been slightly warmed up. So after there's been some gentle movement. And what we suggest is setting up a stretching position to the point where someone feels a stretch, then holding that position for 30 to 60 seconds and repeating that 3 or 4 times for the same muscle group. We suggest having a stretching flexibility program 2 or 3 times a week, but I do want to suggest that I think stretching has a role every day for someone. So it's important to develop a program where you feel that you can stretch the different muscle groups that are tight for you and maybe alternate so that each muscle group gets a chance, or you have a chance to do this more than once during the week. I'd like to give kind of some demonstration or some suggestions of different stretching positions. So here you could see the person with their foot on the box is stretching their hamstring. The two pictures of people are on the floor stretching the chest, stretching the trunk rotational muscles. Person who's at the chair is stretching kind of the front of the hip. And then you can see here is a picture of someone stretching their calf muscle by pushing against the wall. So it is something that it's great to work into an everyday routine, and also something that different classes may incorporate into their training, say yoga class or again, Tai Chi style class. So it may be something to consider with options to get in stretching several times during the week. So with some of these ideas for different categories, let's talk about ways to kind of combine different elements in an exercise program. We've talked about these different exercise components as if they're very separate from each other, but we do want to indicate that certain exercises or certain classes, certain activities can span more than one category. So for example, a, a strengthening type exercise, say for example, a lunge exercise that you see here, that is a strengthening exercise, but it does have a component of balance training depending on how challenging it feels for someone, because the feet end up in a little more of a narrowed position. Another example is some strengthening exercises can have an aerobic component, depending on how intensely or how fast someone does that, or how they design their strengthening program. Say it was kind of a circuit style where one strengthening exercise program went into another. That may start to feel like someone is breathing harder and getting an aerobic benefit of that strengthening exercise. Exercise classes often incorporate a lot of these different elements. For example, say a boxing style class often includes a warm up where someone is sort of gently moving to get started, and then a stretching program, and then a strengthening style program incorporated in the class. And then the movement of boxing itself definitely feels aerobic with how someone's exerting themselves. So something like a boxing class would actually accomplish several of these different categories altogether. And other style exercise classes, say again, as mentioned, Tai Chi, yoga, generally speaking, have movements where the person is shifting weight or changing into different positions, which may challenge balance and may also incorporate different elements of flexibility training. So although we've said these categories are sort of very separate from each other to try to give some of the specific recommendations, we do want to indicate that certain activities or certain style exercises incorporate more than one thing. If we're going to make some very general sort of summary about different components of an exercise program, I just want to share, this is a summary slide that Tim mentioned last month when he was going through the different elements of an exercise program. So again, these are sort of the different categories that we've talked about, and also some different recommendations for sort of how much to do. If we go forward a little bit to kind of getting at the optimal dosing of these exercise components, we can go forward to the next slide. Yeah. For the optimal dose, or how do you know you're getting at sort of the key components for these exercises? For aerobic exercise, we recognize that the intensity of the aerobic exercise seems to be one of the key components for the right dose, or how you know you're getting enough. Similarly, the time component, working up to that goal of 150 minutes a week. With strengthening, we know that the progressive resistance, or the challenge that's progressing with someone, is part of the key dose. Similarly, with balance challenge, that just right challenge, or the appropriate challenge that does challenge balance along with being safe, is the key component. And with flexibility, we know that having some gentle movement to warm up the body is important, as well as the specific recommendations for holding a certain amount of time. So when it comes to dose, these are kind of some of our best guidelines related to what's optimal and how does someone know that they're getting kind of everything that's an important component for their exercise. So if this is new to you, how to start incorporating these elements into your exercise program, how to make sure your program does include all these elements. So one general thought for everyone today is that any exercise program should start with what you enjoy, and also to begin where you're already doing exercise or you're already doing activity. And knowing that although these are suggestions, we're thinking of having everyone begin and work up gradually into uh, these recommendations, not needing to start everything all at once. Also want to let everyone know through the APDA, there are many exercise-based resources, the Be Active and Beyond booklet as mentioned today. There's also additional online exercise class resources that are available to everyone. That might be a nice way to try different style exercises to see kind of what suits everyone. And then the other thing that we'd like to recommend is to consider a physical therapy assessment, especially with a physical therapist that is experienced with evaluating people with Parkinson's disease. That assessment will really kind of highlight areas that are perhaps challenging for someone, and the physical therapist can help design a comprehensive exercise program that would include all these elements. So we are here at Boston University, but we are here for everyone through the support of the APDA. We have our exercise helpline, and we have our email address. So we're welcoming exercise-based questions from people across the country. And similarly, if someone is not sure how to connect with a physical therapist in their area, that is also something we might be able to help with. So I know we have covered a lot today. These are our suggestions of the optimal dose for an exercise program. Next month, we want to continue our series with our colleague Nick Wendel, who'll cover the topic of maintaining motivation to keep up with your exercise program now that you have the benefit of Tim's presentation about the components of an exercise program. And today we've talked about optimal dosing of an exercise program. How do you keep the momentum? So next month, Nick is going to lead the presentation to cover that topic. And actually, we'd like to bring Nick on now to help handle any question from today's talk. So we'd love to know if anyone does have questions related to optimal dosing for their exercise program, or just even to share with us some things that they're already doing to help get all these components in their exercise. So welcome, Nick. We're here to have everyone's question.
Thank you. Thank you for the great presentation, Teresa, and thank you for everyone for giving their comments. I just wanted to share a few comments of different types of aerobic exercise that people had done, because I think it got a lot of variety there. And also, while I'm doing that, if you think of any other questions that you have for Teresa, I'm definitely happy to help facilitate asking those. So Teresa, I think, and many other people talked about how they found dancing to be a fun point of exercise, which was really great. And a few other people enjoyed riding the stationary bike, walking outside, and even boxing. So I love the engagement. Thank you, everyone, for describing how they like to exercise. One question that we had kind of from early on that I think would be good to comment on would be, how do you get in balance training as part of an exercise program? And how do you really know what to do? That sometimes is a little bit more of a gray area.
Nick, that is a great question. And thank you so much to everyone for asking that. It's true that that can be, of all the components of exercise, it can be the one that might be the hardest to figure out on someone's by someone's self, where they could benefit from an individual assessment from a physical therapist. Because what we can do is really examine all the different aspects of balance, and then find out for that particular person, where are the challenges, and then design an exercise program that kind of targets the different elements that are the most difficult for someone. The other thing, I think some of this was mentioned, dancing, Tai Chi, yoga. These are style of exercise classes that often do target balance a little more particularly. And usually the exercise instructors are very good at describing modifications. So if someone is struggling with balance, the most important thing is that they're safe. So not every exercise class is appropriate for someone with balance issues. So sometimes if the instructor is aware that someone is struggling with a balance issue, they can tailor the exercise class or the movement for someone's particular challenge. So I guess my best recommendation is to see if you possibly could connect individually with an exercise practitioner for some evaluation and then specific recommendations. Maybe try one of these style exercise classes and see what balance elements might feel challenging or might feel like they're helpful in training balance.
Great. Yeah, it can be a little tricky. So thank you. Bonnie, I think, asked a great question here, and she asked, "How long should your muscles be sore after exercising?" Sometimes she says she is a little sore when she challenges herself. She wants to know if that's okay.
That is a great question, Bonnie. Thank you so much for asking that. When it comes to exercise, we really recommend that there never should be any pain associated with exercise. And we make the distinction between pain and soreness, particularly when it comes to strength-based exercises, because we believe that the challenge should be appropriate. So there is enough resistance to kind of gain strength out of the exercise. What is typical is to feel some slight soreness in your muscles for, say, 1 to 2 days after someone's been doing a strength exercise. So because of that reason, for the strength-based exercise, we recommend someone is doing that 2 or 3 times a week, but we do recommend non-consecutive days so that there is a little bit of recovery time for that kind of expected, short-lived, kind of delayed muscle soreness. And if someone is experiencing soreness that's lasting, say, longer than 2 or 3 days, that might be an indication that the resistance might be too much of a challenge. If that's the case, then I might recommend that person connect with an individual exercise practitioner just to get some more very individual recommendations.
So we've had some good questions about dosing in the chat, and one question was that 150 minutes a week, is that specific to aerobic, or does that include the strength and flexibility and balance as well? How does that kind of break down?
That's an excellent question. Yes, so the 150 minutes is a little more tailored to the aerobic, moderate intensity aerobic exercise, and that's what's emerged out of the research evidence. So what I've heard from my patients, and Nick, I don't know if you've heard this, I'm sure you've heard some version of this as well, is how to fit this all in 150 minutes of the aerobic exercise to get the strength-based exercise, balance, flexibility. It can feel like a lot, and it's not our intention to have that anyone feel overwhelmed at all. So the 150 minutes is based on the recommendations for aerobic exercise. But as kind of mentioned in maybe some of the talk with Tim and maybe a little of what came up today, what we also hope is that the exercise program, different elements can be incorporated in kind of a similar activity. So for example, say someone is able to get out for a walk, say 30 minutes, 3 times in the week. So that's about 90 minutes of aerobic exercise. But then say they also have a chance to get to, say, a boxing class once a week. And within that boxing class, the activities are fairly aerobic for at least a portion of the time. So those minutes would count as well towards the aerobic 150 minutes.
So that was great, kind of getting some more information about that. Robin Peters asked a good question about how does one find a physical therapist that specializes in PD in their area? Sometimes that can be challenging.
Robin, thank you for that question. That's a great question. So what we do recommend is connecting perhaps with, I'll back up, the APDA has a national chapter and then has a chapter in every state. Oftentimes, the APDA state chapters have websites that have a lot of good local information. Again, perhaps connecting with physical therapists in certain area that do specialize in treating people with Parkinson's disease. Sometimes more hospital-based centers may have someone that has a physical therapist who's certified in neurologic conditions and specializes in treating people with Parkinson's disease. If someone is just struggling and is not sure where to look or even where to begin, that's where we would really love to help at our National Rehab Resource Center, the 1-800 number, or rehab@bu.edu. So that's the contact information for our center at Boston University, but we're happy to help people across the country try to connect with a physical therapist who would know how specifically to help people with Parkinson's disease.
Great. So there's been so many good questions. Keep them coming. We really enjoy answering people's questions. So thank you for all of that. Diane asked a good question about swimming or kind of water aerobics. Does that count? How does that fit into all of this?
Yes, Diane, thank you. What a great question. So movement in the water can be quite aerobic, where you feel like you are getting a good workout. And a nice advantage there is sometimes if people are experiencing a little more stiffness or feel like their joints are more uncomfortable, moving in the water can feel like it's easier to do, can feel more comfortable. Movement in the water definitely counts towards the aerobic suggestions, as long as it seems, and it can be very can feel very intense. You do want to keep in mind that sort of intensity component. So the water aerobics may feel like you're breathing hard, may feel like if you had to rate yourself on that scale, you'd give yourself a 4 or a 5. So it can definitely count towards the aerobic recommendations.
Great. I'm not a big swimmer, but I know many people love it. So good for you. Another question that was from a little earlier on was, is it better to go to the gym for strengthening exercises or better to do it at home?
That's a great question. We hear that a lot. And I think kind of in that question, I would ask that person kind of what version of it would they sort of be more willing to do? What would be the easiest? What would they enjoy? Some people enjoy being at the gym for, say, the camaraderie of other people, or they have a very kind of a set up routine at the gym and they feel that they know what to do. For some people, getting up, getting out, getting into the car to drive where they have to be kind of puts almost like a barrier in their way. So if it was something they could do at home, maybe with more of the body weight support style exercise, could still get a resistance workout, and just more in the convenience of their home. So I think it does depend on the person, and either could be quite effective as long as the exercises feel like they have that strengthening sort of challenge or the aerobic intensity component to it.
Great, great. So again, keep those questions coming in. People are, it's been great kind of getting an opportunity to answer them. One question that, again, was a little bit earlier on is someone mentioned that their husband's having a hard time getting motivated to exercise. How could she as a spouse help him?
That's also what an excellent question. And I don't know if that resonates with other people, but it is something that I hear a lot. And so we know that there can be kind of a little more difficulty with motivation just based on sort of Parkinson's sort of biology. And when it comes to motivation, I know this is something, Nick, you're going to talk about with us next month. So I don't want to steal the thunder there. But I would start with kind of what is meaningful for that person. What do they enjoy? Does music kind of make them feel like they're more willing to move around? Do they feel like if they were going to meet their friend for a walk, that they would definitely do it because they want to see their friend and they're committed to that? So I think it does take a little more questioning is to kind of figure out what's important to them, what would feel easy to do, what kind of suits them, and try to build exercise program a little more around those kind of questions for that person.
Yeah, I think it's tough. It's so personalized, but I think that's what also makes it fun. So John Zachary had a question that was a little more specific to him, but I think could be applied to others. And so he asked, he happens to have a pacemaker. For people maybe like John that have a pacemaker or different changes to their heart, is there any recommendations for intensity? And I know we're not giving personal medical advice, but
yeah, absolutely. So in terms of intensity, we were talking today about the self kind of rating scale of exertion. So that I think could still be effective for really anyone. We also are sometimes recommending a heart rate based kind of formula for exertion. And for some people that does work. For other people, their heart rate is a little more impacted, and it's not the best way to kind of measure exertion. So of course we want everyone to be safe with what they're doing, and any recommendation that's given by, say, an individual doctor or therapist, we'd have people abide by that. But in general, the moderate intensity, I think, is still something that may be achievable. And again, going based off of how you feel, um, I think might be something to kind of guide John by and see if that could work for him. But again, I would also recommend an individual situation connecting with your doctor and getting kind of really a good understanding of their recommendations for your aerobic intensity.
Great. So we've had a lot of good questions. Thank you, Teresa, for answering all of them. We probably have time for just this one last question. And so someone was wondering if they're not really quite getting up to that moderate intensity yet, is that okay?
That's a great, great question. We do want everyone to kind of incorporate safety with their exercise program throughout. And so for some people, working up to a moderate intensity exercise is the way to get started. And in a lot of these research studies, there was a period of time when people were learning the exercise, walking, cycling, and then working their way up to what was moderate. So I would say we know that is the longer term goal, to achieve moderate intensity. But for anyone who's able to get out there and get their exercise, even if it's not a moderate intensity yet, I would say that that's still beneficial. But just knowing that you do want to get to that slightly higher moderate level eventually.
Great, great. And so thank you, Teresa, for all of your information here and for answering all these wonderful questions in the chat. Thank you, everyone, for joining. And we really hope we can join us next month when we discuss how to maintain momentum with your exercise program. Have a great day.